Hi, I'm Dr. Edythe Heus, and I'm going to demonstrate 5 muscles that are utilized in bringing the leg forward, so hip flexion. Those 5 muscles relate to 3 nerve roots, the L3 and the L4 nerve root. And I'm going to use cold laser to stimulate the nerve root to get those muscles to reactivate. Alright, so we have my lovely patient Kim that's having difficulty with her right hip on the flexion of the hip. So I'm going to test 3 muscles that share the L3 nerve root. The first one is the tensor fascia lata. Turn in, hold the muscle there, don't let me push your foot towards your left foot. Okay, and resist. And there's no strength there. And we're going to check Kim's pectineus. Keep your knees straight. We're just up about 20 degrees. And I'm stabilizing her hips. Don't let me push straight to the floor, Kim. Okay, and there's no strength there. And her iliacus, straighten your knee. Turn your leg out. I'm going to bring it in just a little bit. And I'm going to push down towards the floor at a slight angle. Hold strong. And there's no strength there. So these 3 muscles are reproducible muscle tests that are very easy to do, and the 3 of them, as I said, share the L3 nerve root. So at the level of L3, at the umbilical area is L3 nerve root. So I'm going to hold cold laser over the nerve root. And I like to contact the L3 nerve root posteriorly, because sometimes there's tenderness there, or I'll feel the tissues tense. Do you have any tenderness down there? Okay. And I hold the laser until I feel a shift in the tissue. And with my hand on the back of her spine at L3. So the laser's treating and a little bit of manipulation I find useful. While I'm holding the laser over this area, I can also sense other areas in her body that are picking up the signal that are related to the L3 nerve root. Okay, let's check those muscles. Turn your foot in. Don't let me push. Hold strong. Okay, so there was no change in that muscle. Let's check the pectineus. Don't let me push down. Little improvement in that. Turn out. Don't let me push down and at an angle. Okay, that's noteworthy that is fine. Now turn this in again. Hold strong. Okay, I'm going to have you hold your hand right to the left of your belly button. Turn in. Don't let me push. Hold strong. Okay, and there's a little improvement there. So what I failed to show the first time was I just went on the side of nerve root involvement, but it's really best to check and see which side of involvement. Now, the right side, L3 nerve root could be involved, or on the left. We also have to check the cerebellum or the cortex, and I'll demonstrate that. Do you have any tenderness on that side?
No, it's just on the other side.
Reach underneath. Let's check and see. Turn your foot in. Don't let me push. Okay. touch back here. So the point behind the ear where the mastoid is relates to the cerebellum on that side. Don't let me push, hold strong. No change on that. So touch cortex. Turn in and hold strong. Movement there. Take your hand off again. So some of these points can take up to 2 minutes. Don't let me push, hold strong. Okay, so that was a significant change. Let's check the pectineus, straighten your knee. Don't let me push down, hold strong. Okay, that's good. And the iliacus. Don't let me push. Okay, so to just make improvements on those three, the nerve root, L3 nerve root needed to be activated on the right side and the left side, and then her cortex on the left side. Okay, so now I'm going to check the two L2 nerve roots, and that's the rectus femoris straight head and the psoas major muscle. So rectus femoris, hold that up, don't let me push down. Okay, and that's going to be L4. Let's just check the psoas at the same time, don't let me push down. Okay, L4 is just about an inch below the belly button. Rectus femoris, test again, don't let me push down. Okay, no change with that. Let's see if there was a change with the psoas. Strong. A little bit, but let's go over to the left side. I like a bigger change if possible. Don't let me push, hold strong. That was easier to hold, wasn't it? It's not locking precisely, but that was a big difference. You notice that piece. Okay, your hand off. So again, I'm holding the back side around the L4 nerve root, L4 musculature around it as well, and the laser is 1 inch below the belly button off to the left side. So the nerve root can be involved on the right side or the left side for either side of muscle weakness. Okay, so can you feel any of the...
Yeah, definitely felt the difference after the first treatment.
Okay. The muscles were stronger, it was easier to hold the muscle, yes. And I'm real particular about consistent muscle testing because the patients can tell if you push harder the second time or the first time to demonstrate how weak they are and then how strong they get. It's not very convincing to your patients if you're using different degrees of pressure. Okay, we're going to test those two muscles, the rectus femoris. Hold this up, don't let me push down, hold strong. It's a little bit better, but it's not a good change, a comprehensive change. Don't let me push down, strong. Now that's a lot better.
That one felt a lot stronger.
Okay, so let's have you touch behind your left ear. Oh, I'm sorry, your right ear. My mistake, good. And hold your leg up. Don't let me push down. You can also see that your hip really rides up because of the weakness. So touch on the left side of your head. Yeah, great. Okay, don't let me push down, hold strong. Okay, so no help on that. So take your hand off, just check something. So obviously there's more than nerve root involvement here or cerebellar or cortical involvement. So there are some myofascial points right at the rectus femoris. So that is noticeably tender, noticeably tight, and tender as well.
Yes.
And I'm just gonna check along the rectus to see if there are any other points. Kim, have you ever had any knee pain on this side?
No.
Have you been paddling at all lately?
No.
Okay, so I'm just going to use the cold laser along the point of attachment of the rectus femoris. And we're going to see if that activates it. So this is just red laser, and if I don't get a change with red laser, I'll switch to infrared and see if there's a change. Are you as jumpy there? Does it feel as tender? Okay. Hold your leg up. Don't let me push down. Hold strong. So there's not a change in the strength, but you're not recruiting as much with your left hip. So we're going to go on to infrared.
I can feel the side shaking when
Before?
yeah.
So on the infrared setting, there's some red light associated with it so that I know that it's on and I can see where it's focusing. Infrared is helpful for more local issues, and since there may be involvement of the tendon as well as the fascia, we're going to see if infrared helps. And actually I can feel a change in the tissue more than I was with the red laser.
No, I can feel a difference. It was tighter before. It's not so tight.
Yeah, it feels like it's just melting
Yeah.
away. That's nice to feel, because
Yeah.
you don't always see that kind of obvious change, but I've been happy with how the infrared's been working on the fascial points. Okay, hold this straight up. Don't let me push down, hold strong. Okay, so much less recruitment, but we're clearly it's not fully engaged. Okay, so the infrared did create more strength, but I'm not getting the locking action that I want. And I realized that when I used just the red, I was doing it through her clothing, so we're just going to go back and do the red again, but directly on her skin, and see if that makes a difference. Okay, I'm going to have you lift your leg up. Don't let me push down. Hold strong. So another thing that I like to do is actually put the muscle through its range of motion and ask for resistance. Are you doing okay?
Yeah.
It's not too stressful for
No.
you? Okay, relax it. Okay, let's see if that makes a difference. Hold your legs straight up. Don't let me push down. Hold strong. Now, it made a little bit of difference. Each time things are incremental. Sometimes you hit the mother load right at the beginning, and sometimes you don't.
Mhm.
Kim's been incredibly physically active, a lot of hiking, history of outrigger paddling, paddle boarding, pretty much everything. So I'm going to use just the red and working at the insertion of the rectus muscle. Do you have any tenderness?
Right there. A little bit.
Just that. Hold your legs straight up, telling me push down, hold strong.
Oh, I can feel a difference.
So we're going to go to infrared at this end of the muscle. There are many things that go into the integrity of a muscle or how it works, and I'm just showing some of the basic treatments that commonly have a huge impact on how a muscle functions and in turn how the movement works or the joint functions. Any tenderness to the touch there?
Just a little bit.
Hold your leg straight up, telling me push down. And that locks.
Yeah.
You can see the ease with which you can hold that. So anyway, this is another simple demonstration of how to use cold laser and some of the techniques involved. So to summarize, to improve Kim's hip flexion, I tested the tensor fascia lata, the pectineus, the iliacus muscle, that all received an L3 nerve root. We had to treat both sides of the L3 nerve root as well as the cortex. Then I tested the psoas major muscle and the rectus femoris muscle. And to get the rectus femoris muscle working required nerve root stimulation of L4 on both sides, as well as direct work to the origin insertion of the muscle using both red laser and infrared. So thank you for joining me, and I hope you found this beneficial.